Welcome to Living the Life. We're so glad you're with us today. We always have such a good time when we're together. And today, I don't know that you'd call this fun, but it is an important subject, prostate cancer. It's the second most common type of cancer among men in this country. We're going to meet a doctor who's pioneered new and improved surgery. That's good news, and it's helping many men. So we'll tell you more about that. Well, prostate cancer can be devastating to men and also to their wives. But Dr. Arnon Krongrad has been a godsend with a whole new way of treating it, and he's here to tell us more. Welcome back to Living the Life. Good to have you here. Listen, can you give us, first of all, before we talk about any procedures that are done, sort of an overview on, you know, at what age do men become most susceptible to having prostate problems? What are some of the things that contribute to it?
The general background is it's the most common cancer of men. In the United States, it's 1 out of 6 men is diagnosed. We're losing 500 men a week to prostate cancer.
500 a week?
Imagine a jumbo jet every Friday crashing.
Oh, my.
But here's the good news. The mortality rates are starting to drop, not only in the States, but also abroad. And they're dropping because of something very simple, early detection, which is easy to do. PSA and a physical exam. Wow. Easy.
Are enough guys doing that, though? You know, men are notoriously bad when it comes to doctors and physicals and things like that.
Anybody with a Y chromosome is a problem child. That's exactly right. And that's where we need the women to get involved. And one other point, it's not only an old man's disease. You know, we tend to think of it as grandpa's problem. I just operated on a man who's 31 years old who has prostate cancer. And it's such a simple test, PSA and blood test. Go get it.
So men should get in their 30s then? Start in their 30s to get the test?
No, I'm not advocating that. But I do want to use that case to illustrate the fact that you're not necessarily off the hook because you're young and feel great. You know, you're getting your cholesterol checked. How hard is it to add the PSA? It's the same blood test.
But doctors don't always do that, though. You have to ask for it.
Well, you also did pioneered a surgical procedure, didn't you, that's really offering a lot of hope. And what would you say about that?
Well, I think that's the other key point here. Not only is early detection really easy to do, but in the past, the treatments were really quite brutal. And the fact is that in 1999, we started a new way of doing the prostate cancer surgery.
How is that?
It takes 2 hours to do. I have you in the hospital for 1 night on average.
Wow. Not you.
2 Tylenols. Not
Thank
you.
But
Yes. Good point. Thanks for clarifying. Thanks for clarifying.
I was getting scared, could you tell? No, I'm kidding.
You're off the hook.
Yeah.
Okay, all I'm saying is no blood transfusions, 2 Tylenols. Okay, easy to do. Wow. That's the point.
That's amazing.
Yeah.
Now, with this new procedure that you're doing, what about some of the after effects and ramifications? When you're talking about prostate cancer, that's why a lot of men don't go. It's like, if I don't have to face it, I don't have to deal with it.
Yeah, there are a number of taboos. There's actually starting to erode. We're seeing that not only in the United States, excuse me, but also in the Caribbean, for example. You're talking about erectile dysfunction and incontinence. Here's another key point. Who treats you matters. In other words,
The doctor's experience.
surgeon experience and surgeon focus is critical to your outcome.
And probably early detection as well, right?
Yes, yes. The likelihood of ill effects, if you will, from treatment varies as a function of your age, of your smoking, of your medical conditions. So there are lots of different variables that you really have to talk about. It's a complicated discussion. It's one that is a subject for a show all on its own.
I understand you performed the procedure on Pat Robertson, and he was on a horse, what? How long after?
Like a minute and a half
Within
after.
a minute and a half after. No, I'm kidding. It was about a week after.
That sequence was remarkable. And it's actually quite typical, actually, for what these patients do. But within a minute and a half of waking up, he was writing a press release to tell everybody he was okay.
Unbelievable.
He was. Yeah.
Wow.
He was out of the hospital. The next morning, he was riding a horse 10 days later. But I want to tell you, just to illustrate how quickly patients can come back to full function, one of my patients actually broke a swimming world record 3 months after having one of these.
That is incredible.
Really?
Bob Patton, Littleton, Colorado, the 200-meter breaststroke record 100 days after his LRP.
Wow. What is prostatitis? And
Yes.
how?
Is that confusing?
Yeah,
Let's talk
we're
about
not,
it.
we're not sure what that is.
Okay. We have 3 basic problems with the prostate. Cancer is one, we just talked about that. There's benign enlargement, which causes symptoms as you get older, you have to urinate at night, stuff like that. Prostatitis is a 3rd category. It's an inflammation, a very symptomatic inflammation of the prostate in the United States that accounts for 2 million doctor visits a year.
Good grief.
So it's a public health problem. It's actually quite big. On a personal level, it can be ruinous because it causes all kinds of pain, discomfort, bleeding, fever during urination, sex. Yeah, and it's a disease of younger men. So it's a different condition. Generally speaking, they're younger than the prostate cancer patients.
How do you treat it?
There are two forms. There's the acute form, which is infectious, Antibiotics work, it goes away, you're done. Finished with acute prostatitis. The chronic form, which can last for years and actually decades in some men, has no known treatment.
Oh, there's the answer you want to hear, huh?
But you're the doc. You're good. You have an institute and everything. Can't you figure it out?
Well, here's what happened in regards to chronic prostatitis. A couple years ago, somebody sent me a patient who had had 8 years of misery, pain and bleeding, and all that kind of stuff. Couldn't sit. The guy went everywhere with a donut cushion.
Oh, my word.
He asked me to take out his prostate as a last resort. Long story short, I won't share all the details with you. I read him the riot act. I said, there's no proof, there's no evidence, all of that. Took out his prostate. His first words to me, waking up from surgery, was, I feel like somebody pulled a golf ball out of my...
Wow.
Yeah.
Really?
Yes, and he's had a durable response. It's been 2 years. I've since done that procedure for other men with chronic prostatitis. Same response.
Same
So
response.
we're now starting a clinical trial really to get a better handle on this, what may be a real breakthrough for men who have been suffering for years, actually.
Can I ask you, when we started talking early on, you said the statistics that you were giving were for men in this country. Is there something in our lifestyle or our food or something that we do that makes those stats American stats, or is that worldwide?
I'm using American stats simply because I have a better handle on them. The conditions we're talking about, prostatitis and prostate cancer, are really global problems.
Wow.
Yeah, they're not uniquely American.
Tell us about your institute as well, because you're doing all sorts of great work there.
The Institute is kind of special, I think, for two reasons. Number one, we have the greatest experience. We've been doing this minimally invasive prostate surgery since 1999, so we are America's pioneering and original prostate cancer surgical program. What I think really makes us special, though, is our commitment to service. We actually answer your phone calls. We answer emails.
You've got to be kidding.
Can you believe it?
That's really what? Yeah, we're just going to call just to talk to you. It's so rare.
My secretary's name is Hope. If you're looking for Hope, here's the
that's
number.
right. Hope, pick up the
So,
phone.
no wait appointments, VIP service, concierge service. Patients actually would say to me, it's really strange, they say, why did you answer my phone call? I said, well, because you left me a message. And they say, well, that I don't understand. And they're troubled by it. I said, you know, if it'll make you feel better, I'll ignore you for 2 weeks and then call you. And then they relax and get into it. But we never understood why a medical environment has to be toxic, why it has to smell funny and look funny and ignore you. We don't buy into that.
Yeah, so much of this is intimidating to begin with. Well, if you want more information on this topic, please visit our website. It's livingthelife.com, and we'd love to have you find out more, and we'll give you information on how you can get to Dr. Krongrad. Thank you so much.
Thank
Great to
you
have you with
very
us.
much.
We appreciate it.